This is One-on-One. The Affordable Care Act being implemented in January of 2014. What is it? Why does it matter to you? What impact will it have on physicians and the relationship between physicians and their patients? We are pleased to introduce our good friend. He hasn't been on the air with us for a while, but he will in the future. He is Larry Downs, the CEO and General Counsel of the Medical Society of New Jersey. Good to see you, Larry.
Thanks for having me, Steve.
Years back, we used to do a lot of smoking education, smoking cessation programs. Glad to have you back representing the Medical Society. The Affordable Care Act, most importantly, what impact will it have on the relationship between physicians and their patients?
Well, I think the impact is yet to be seen. We do know there will be lots more patients coming on to the insured rolls, and we have a static number of physicians and a declining number of physicians to care for them. So I think it'll require healthcare to be delivered in more of a team environment.
What does that mean?
And that means a physician can delegate certain tasks to nurse practitioners, physician assistants, lesser trained individuals in a healthcare team, but still with the physician oversight that allows clinical care to be delivered at high quality.
Okay, listen, people just watching you right now say, hold on. Larry Downs said lesser trained individuals. I mean, does that imply that there's an impact on quality?
I don't think so. I think if the team is constructed properly and physicians are working at the top of what they do and can delegate and put people into positions that can treat common illnesses within this medical home model where physicians and other professionals are working together, I think it makes the care more coordinated and probably gives us better outcomes and allows us to accept more volume going forward.
But the whole question, Larry, about primary care physicians in cooperation with our colleagues and partners at the Healthcare Foundation of New Jersey, we've been doing a whole range of offline, if you will, discussions, forums, where we've been trying to deal with this question. What does it mean, the implementation of the Affordable Care Act? What impact does it have? And the primary care physician issue comes up over and over again, that we don't have enough. We just don't have enough primary care physicians. What do you see out there to cause you to be optimistic about this?
Well, I think what we as a state need to really come to grips with is the environment in which we have created here for physicians in which to practice.
What does that mean?
We have an environment that's highly litigious here in New Jersey. When you compare us to other states, we have more malpractice claims filed here than similar states with larger populations of physicians. We have a lot more bureaucratic red tape for physicians to go through, and we have a high cost of living and a high cost of doing business here. Rents are higher, employee salaries are higher. So this is a tough place to open any business, let alone a medical practice. So I think the state needs to look at making the state more competitive to attract new physicians here, because we will be in competition with other states for newly minted physicians coming out of training and for physicians looking to locate their practice in other places.
What did the Affordable Care Act do specifically to deal with, just let's say, the malpractice issue that you talked about, the litigious nature of this situation for so many physicians who say they have to practice in a certain way to try to minimize the potential for a lawsuit, which obviously is driving up healthcare costs exponentially?
Well, defensive medicine costs are clearly out there. The health payers know it, the doctors know it, and most of our doctors will practice according to clinical care paths and protocols that are fairly well established and agreed to by the medical profession and by the payers. No excessive testing, things that drive up the cost of care. However, in a bad outcome situation, it's really easy for a plaintiff's attorney in New Jersey to ask the doctor, why didn't you order that one last test? You could have detected this outcome. Until we get away from that kind of a scenario and environment here, it's going to be really hard for physicians to have to comply with the downward pressure on healthcare costs and complying with these new team-based models if they're constantly looking over their shoulder and trying to figure out whether they're going to be the subject of a lawsuit, which is devastating for a physician in practice.
Let me ask you something about physicians. And I don't like the whole question of painting a community, a profession with a broad brush, but you deal with physicians in general. I'm going to break my rule right now.
Okay.
The discussion about having other medical professionals, nurses, physician assistants, and others, be more actively involved in patient care. And I know it depends upon the particular procedure. I know it depends upon the particular clinical professional. But what would you say to those who have argued that in the effort to reform healthcare, to bring down costs, to provide quality healthcare to more patients, citizens who historically have been denied access, that some physicians have been resistant to having other healthcare professionals, other than physicians themselves, not enough of them, do this, that they have resisted, you say?
I don't think that, I think that it depends on how the physician works within the team.
Give us an example where it's not good.
We can't just give nurse practitioners and other non-MD and DO providers independent practice, for example. We can't make them interchangeable with a primary care doctor. I mean, there are the primary care physicians, pediatricians, people on the front lines of care are highly trained, understand the interactions between various organ systems and disease. I mean, these are physicians that pick up the odd diagnosis. They're the ones who are trained to see beyond the symptoms that are presented. When you are in a situation where you're getting your health care, you need to have that level of expertise somewhere within the team.
Does the Affordable Care Act do anything, from your opinion, representing the medical society or physicians in the state? Does it do anything to mitigate against that?
I think it.
Are you concerned?
I am concerned only because of the confluence of events here. I'm concerned about the ACA, our political, our policy environment in the state right now regarding less protections in malpractice reform.
I think what you're talking about is the influence of, listen, I think what you're saying is, when you talk about the political environment, is the tremendous influence of the trial lawyers. I think that's what you're saying.
I think they have tremendous influence within the legislature, and I think that we need to look more broadly at the cost of care here in New Jersey and what we can do to incent doctors to practice in a more uniform fashion without the worry of having a malpractice claim brought against them.
Because if that does not happen, what?
I don't think that doctors comply to the point where we need them to in order to lower costs. I think doctors would be happy if they followed an established clinical care protocol and they knew that there would be presumption against liability if there was a bad outcome. I think doctors would follow those protocols, be more likely to adopt and reuse diagnostic testing that maybe another practitioner ordered, and be able to rely on the medical record and the care delivered by others if they weren't going to be subject to a.
I hear you. I got to do this though. I know you're walking a fine line, but if you were a patient and you were preparing for the implementation of the Affordable Care Act in January of 2014, would you be concerned about the relationship that you have with your physician right now?
I would not. Physicians are highly trained. They take an oath to do no harm. They have severe concerns about some of the ACO and shared savings programs that are out there, and that is why we believe at the Medical Society that any of these initiatives need to be physician-driven and physician-led, not corporate-led, not profit-driven, but the best care at the most efficient cost. And unless physicians are involved in that leadership, I would be afraid.
Make sure you come back and talk to us again about this. It's not going away. Patient education is our top priority here, particularly as we move toward January of 2014. Larry Downs, thank you.
Thank you, sir.
The CEO and General Counsel of the Medical Society of New Jersey, representing the physicians in our state. Thanks, Larry. Stay tuned. We continue to try to examine this very important issue. Thank you.
One-on-One with Steve Adubato has been a production of the Caucus Educational Corporation, celebrating 25 years of broadcast excellence. Funding for this edition of One-on-One with Steve Adubato has been provided by the Healthcare Foundation of New Jersey, founded by the Jewish community, and by Health First New Jersey. Promotional support provided by NJ Biz, All Business, All New Jersey, and by the New Jersey Business and Industry Association and its monthly magazine, New Jersey Business. Transportation provided by Airbrook Limousine, serving the metropolitan New York, New Jersey area. One-on-One with Steve Adubato has been produced in partnership with St. Joseph's Healthcare System.